Racism in Canadian history. Racial discrimination in Canada. Canada has a lot of racism in its history. Knowing the history of racism in Canada allows us to understand the intergenerational trauma and ongoing effects of historical and current racial discrimination. Hey, you need to understand the past to get to the present. Canadian history, as taught in schools, emphasizes the European perspective. Many people are not aware of the history of racialized people in Canada. It would take me a long time to go through all the incidences, so let me give you a few outstanding examples. Number 1. Slavery in Canada, 1628 to 1800. In New France, French and English settlers enslaved blacks and natives. When the Loyalists took possession of New France in the 18th century, there were about 4,200 African slaves on Canadian territory. Having no basic rights, slaves worked without pay and in horrible conditions, sometimes being tortured, raped, and even killed. Slavery was abolished in 1834 by the British Parliament. Number 2. Chinese Pacific Railway workers, 1881 to 1884. In the 1800s, 15,000 Chinese workers were imported to enable the construction of a Pacific railway from eastern Canada to the west. Chinese workers worked in dangerous and difficult conditions and were paid very little. Many of them died on the job. It is important to understand that this railway was built on Indigenous land. Number 3. The Komagata Maru. 1914. The Komagata Maru was a ship owned by an Indian man by the name of Gurdit Singh Sirhalli, who, despite strict regulations on South Asian immigration, was keen to facilitate the immigration of financially stable Punjabi men. The Komagata Maru incident highlights two beliefs of the time. The first being that Canada is an exclusively white country, and the second being that the Indian people belong to the British Empire. Once the ship arrived at the port of Vancouver, Canadian authorities refused to allow the vast majority of the passengers, who were Sikh, Hindu, and Muslim, to even disembark from the boat. The boat's passengers resisted for a month until the case of the Komagata Maru was legally assessed and a Canadian court refused their entry. As a result, the ship had to turn back. Once back in India, an altercation broke out when the British authorities refused the passengers' right to leave freely. About 20 of the passengers were slaughtered and many others were imprisoned. Number 4. The MS Saint Louis liner, 1939. At the dawn of the Second World War in 1939, 963 Jewish passengers on the ship Saint Louis liner sought refuge in Canada after being refused entry into Cuba and the United States. They were refused entry by the Canadian government. The ship had to return to Europe, where the passengers were dispersed to various European countries. Unable to find refuge in Canada, 254 of the passengers were murdered in the Holocaust. Number 5. The imprisonment of Japanese Canadians during the Second World War, 1941 to 1949. As early as 1877, a number of racist laws against the Japanese population were introduced in Canada, such as prohibiting them from voting. The Japanese attack on Pearl Harbor on December 7, 1941, during the Second World War only worsened these prejudices. In 1942, the Canadian government, through new regulations, expelled approximately 8,000 Japanese Canadians from their homes and properties in Western Canada and sold them. As a result, the Japanese residents were all confined to a park in Vancouver. A total of 21,000 Japanese Canadians experienced this fate. Number 6. Racism in the immigration system. There are many examples of racism in Canadian immigration policies. Two examples are, from 1880 to 1923, a minimum of $50 tax was imposed on any member of the Chinese population wishing to immigrate to Canada. This tax existed in order to limit the immigration of Chinese to Canada. In 1919, new regulations prohibited certain religious, political, and racial groups from immigrating to Canada. Number 7. Residential schools, 1886 to 1996. In 1880, the introduction of a new government policy on education, which included the goal of religious conversion, led to the establishment of several residential schools across Canada. Residential schools were intended to acculturate and convert First Nations, Inuit, and Métis people to Catholicism. Cultural assimilation took many forms in the residential schools. The curriculum was not at all culturally appropriate, neither in terms of its content nor in the language in which it was taught. Indigenous residential school students were given new names. They were separated from their families, sometimes for several years, and they were forbidden to speak their native language, even when writing letters to their parents. Overall, the quality of education offered in residential schools was poor. Until 1950, half of a daily school day was spent doing household chores. Living conditions in the boarding schools resulted in several cases of physical and sexual abuse being reported. Due to overcrowding and the quality of the food, the boarders were much more vulnerable to disease. In the end, the community fought for a long time to end the residential schools. In 1996, the last Canadian residential school closed their doors and the battle was won. Yes, it took till 1996, which isn't that far back, is it? I wish I could tell you racism was just a thing in the past. Unfortunately, it lives on today. Racism today. It is important to note that the legacy which was created by the racist history of the past persists today. Racism manifests itself in many different spheres of society. In academia, in the workplace, in the goods and services sector, and in health services, among others. A report examining race relations in Canada in 2019 states that 1 in 5 Canadians report experiencing racial discrimination on a regular basis. That's over 7 million of us. Number 1, academic environment. In the education system, racialized students face several systemic barriers related to discrimination. At school, college, and university, racialized students are also subject to racism by other students, teachers, and administrative, educational, and support staff. Racial discrimination in the academic environment manifests itself in several areas such as grouping by ability, denial or minimization of racially motivated incidents, exposure to Eurocentric, monocultural, and exclusionary curricula, bias in testing and assessment, harsher or unfair disciplinary measures, lack of representation and diversity in faculty, negative and stereotypical attitudes towards racialized students, and a lack of programs which meet the needs of racialized students. I could go on. Number 2, work environment. Racism is also evident in the Canadian employment sector. At the systemic level, marked differences in wages and unemployment rates have been identified among racialized people compared to non-racialized people. For every Canadian dollar earned by a white man, racialized women earn 59 cents and racialized men earn 78 cents, with this wage gap being more pronounced among Black people compared to white people. In addition, racialized people, although more active in terms of job search than non-racialized people, face an unemployment rate of 9.2% compared to 7.2% among non-racialized people. Among Canadians reporting incidents of racial discrimination, 38% say they experience discrimination at work. Examples of racial discrimination in the workplace include being perceived as less intelligent than other coworkers, assuming that a racialized person is working in a position that is lower than their actual position, being the constant target of inappropriate comments or racial taunting, and being disciplined more harshly than non-racialized individuals. Number 3, goods and services. In Canada, everyone has the legal right to receive goods and services and to use facilities without discrimination. However, among Canadians reporting incidents of racial discrimination, 28% of these events took place in shops or restaurants, 19% when using public transport, 16% when using public services, and 12% when interacting with the police and the justice system. Looking at racialized groups separately, Black people and Indigenous people report more discriminatory treatment in the use of goods, services, and facilities. Examples of discriminatory treatment in the receipt of goods and services include being followed in shops, being ignored in restaurants, being unfairly stopped by police, or receiving services such as a bank loan, but with more severe conditions than non-racialized individuals. Number 4, health services. In health services, racism manifests itself mainly in subtle and systemic ways. The impact is most evident in health disparities among racialized groups. One researcher examining health disparities in a social, political, and economic context reveals that racism impacts health through the following 6 mechanisms: economic and social deprivation. Health services which are not as readily available to people with low incomes or in low-income areas may create a systemic barrier for racialized people who, because of historical disadvantages, are more likely to live in poverty. Toxic substances and hazardous living conditions. Indigenous people in Canada are among those most affected by the effects of toxic substances and hazardous environmental conditions. For example, in January 2018, there were approximately 137 drinking water advisories in Indigenous communities across Canada. In addition, sewage systems are often inadequate in these communities. These unsafe environmental conditions increase the risk of contracting infectious diseases. Socially inflicted trauma. Experiences of racism are often experienced in a traumatic manner by affected individuals. They produce physiological responses that significantly increase the risk of cardiovascular, endocrine, neurological, immunological, and psychological health problems in racialized individuals. Targeted marketing of products which can be harmful to health. Harmful products including junk foods and psychoactive substances such as alcohol, tobacco, and other legal and illegal drugs are marketed throughout Canada. Targeted and biased marketing of junk food has been associated with increased consumption of these products linked to several health problems, such as obesity and chronic diseases like cardiovascular diseases, type 2 diabetes, and certain cancers. A study of which analyzed the content of food and restaurant advertisements aired during prime time on 3 major television networks, CTV, Global, and the CBC, revealed that these ads were tainted by harmful stereotypes. Overall, white people were overrepresented in food and restaurant ads and were associated with nature and healthy, unprocessed food. In comparison, Black as well as East and South Asian people were underrepresented in food and restaurant television ads overall, but were overrepresented in junk food ads. Inadequate or degrading medical care. Racism manifests itself directly in the provision of health care. Notably, racialized immigrants, including newcomers and refugees, are particularly affected by racial discrimination in Canadian health services. They report discrimination because of their accent, language, culture, religion, and country of origin in the provision of medical services. In addition, a review of the literature on racial discrimination in the provision of healthcare in Canada reported that racialized people perceive various types of negative experiences in the healthcare system, including insensitive, hostile, or ignorant treatment by providers, as well as racial slurs, stereotyping, and reception of substandard care. Ecosystem degradation. This is especially, but not only, the systemic alienation of Indigenous peoples from their lands and the corresponding traditional economies. Uprooting and migration have been recognized as social detriments of health by the World Health Organization. In Canada, Indigenous populations, as well as many racialized immigrant groups, continue to experience the impacts of exploitation of their native lands linked to colonialism and slavery. The consequences of uprooting include the loss of their cultural identity, their traditions, their family structures and relationships, their collective autonomy, and their traditional economies. These factors with transgenerational effects are associated with health disparities amongst racialized groups. So there you have it. Now you know what racism is, the history of racism in Canada, and some of the ways it exists today. It's now time to learn what you can do to recognize it and ensure you're anti-racist.